A very warm welcome to my lovely audience. Today we have with us Dr. Karishma Kirti, an oncoplastic surgeon and a breast consultant. Today we'll have an insight on her wonderful journey. So, hi, ma'am, how are you and how does it feel to be here?
Hi, everyone. I'm very, very happy to be here. Of course, I'm a breast cancer surgeon, but one of the very important things and something very close to my heart is actually talking about breast surgery to people who don't have cancer.
Yes.
Yeah, so I'm very happy to be here. I love to take opportunities such as these to talk to the general public and increase awareness about the disease.
We are so happy to have you here, ma'am. So, can I get started with the questions?
Sure, of course.
Yeah. So before we get into the details of breast cancer and its awareness, let us know a little bit more about yourself. So could you tell us how you started your career and when it all started and when you decided to choose that this was gonna be your path?
Everyone has a different journey, but it all boils down to, I think for me, it was serendipity. I mean, just being at that place at that time. When I started off, of course, I had sciences in school, but I didn't start off thinking I wanted to be a doctor, although that was my family's wish. Um, but I did get into medicine and I wanted to do something around environmental science. But I'll tell you the thing about medicine is that it's very interesting. I mean, you learn things that you didn't think were possible, and the other thing is that it's very rewarding. So once you do MBBS and you get into residency, actually talking to patients and treating them is a very rewarding experience. There's nothing um, you the value of the work that you do, the service that you give, it's quite transcendental. And because of that, I think I stuck by it. So I started with sciences. I went through med school. I did general surgery, and after that, I joined Tata Memorial Hospital, which is one of the biggest hospitals for cancer treatment in India. In fact, in probably in Southeast Asia. But so there, I mean, I saw a variety of patients, and the experience that I got there was phenomenal. But that's what I did. I mean, I did general surgery, and almost immediately after that, I went into breast surgery, and I've been doing that for almost a decade now.
All right. So that was actually an wholesome answer, how people talk about how difficult it is to, pursue MBBS and all that, but it is rewarding. So nobody talks about it. Yeah. So, as someone who doesn't have the knowledge of, you know, the breast cancer awareness, how would you like to guide me through the process?
There are many components to understanding breast cancer,
Yes.
how it could possibly ever affect your life. And so I think I would start with learning about breast cancer. The most important thing is understanding your risk. Okay, which
Yes.
is sort of understanding what are the risk factors for breast cancer. And when we talk about that, we generally divided them into two, saying that there are some things that you can change and some things that you cannot change. So being born female inherently puts you at a higher risk. As your age increases, your risk increases. If you choose not to or can't have children, your risk increases. If you don't
Okay.
breastfeed, your risk increases. So these are some of the things that are what they are. And there are some things that you can change. For example, like breastfeeding. Breastfeeding for 6 months up to a year, that reduces your risk. Reducing the use of oral contraceptive pills or
Okay.
hormone replacement therapy after menopause. These are some of the things that will help you protect against breast cancer. Keeping your weight in the normal weight range and doing some physical exercises, eating healthy, reducing alcohol. These are some of the main things that help you reduce your personal risk of alcohol. There's some things you can't change, like your genetic makeup. Some people have a lot of family history of breast cancer. Those are things you cannot change. If you've received radiation in childhood, you can't change that. But the things that you change and you can change, that you can work on, that is what I mean, would probably be my message today. So knowing your risk. The other thing is what breast cancer looks like, right? We understand that your risk may be high or low, but it doesn't mean if you're at low risk that you cannot get breast cancer. So everyone has some risk of developing breast cancer. And then knowing what breast cancer looks like, having a painless lump in the breast, having nipple changes, some changes in the breast skin, like swelling or redness which doesn't go away, if there is a wound on your breast which is not going away, if you have some discharge from your nipple, if you have some other swellings around the area like in your armpit, this is what breast cancer generally presents as. And very often people don't know about it, and unfortunately people are scared of it.
Yeah.
So unfortunately, we still have patients who are A, scared of the diagnosis, B, don't want to be treated as breast cancer patients, or are embarrassed that they have something in the
Yeah.
breast, which is, a personal private part. So a few of those notions need to go away. We need to know the risk factors. We need to know what it looks like. And probably, I think as we go ahead, we can talk about screening, how to examine yourself, or the role of mammography in screening, all of these things. I think they're all quite important. So I think, I know it, I spoke a lot about it, but I think the main thing is knowing your risk, knowing what breast cancer looks like, and knowing how to examine yourself. I think these are the three things which are very, very important.
Yeah, I think that was very informative for someone who doesn't know about it anything. Yeah, so how do you think, speaking and creating awareness of breast cancer can actually prevent people from acquiring one?
So, prevention of breast cancer is a big one, right? There is no
Yeah.
fail-safe method. The things we can do is, maintaining a good weight, doing around 2.5 hours of exercise per week, which is really not much, And I'm
Yeah.
not saying you have to lift heavy weights. Even a brisk walk, 20 to 30 minutes a day, can, that would reach your quota of your required or recommended weekly exercise. And alcohol,
Yeah.
probably these three things in terms of lifestyle changes. Other than that, I would probably say that know how reproduction and your obstetric history can change, because breast cancer is a very hormonal sort of disease.
Yeah.
So the longer number of years you're on contraceptive pills for, if you've been taking it for 5 years, there are other methods of contraception. Speak to your gynecologist, know your choices, and take a break, because those are known risk factors. So probably reducing your risk factors would lead to some risk, to some prevention of some breast cancers. But I think creating awareness helps more at the level of catching cancer early. And when you catch cancer early, you have generally lesser treatment, better
Yeah.
outcomes. And that is, I think, what we try to target when we talk about awareness.
Yeah. So as we're speaking about early symptoms and early signs, so could you tell us what are the very basic early, signs and symptoms that we shouldn't ignore when it comes to, breast cancer?
So when it comes to breast cancer, you picked up a good point. I would say that any symptom should be addressed. If you have any breast change, which lasts more than one period cycle, you need to get it investigated.
Yeah.
Um, the most common symptom of breast cancer is a lump in the breast, and generally it is a painless lump. Because very often it's painless, it gets ignored, or there is a thought that if it's not painful, it's nothing.
Yeah.
But unfortunately, breast cancer is a painless lump in most cases. So that is one thing you need to watch out for. Then sometimes there may be some nipple changes, like a nipple discharge. So sometimes we get very early, in fact, what is known as DCIS or pre-cancer, which presents as a blood stained or a clear nipple discharge. So any kind of nipple discharge, especially when it's only in one breast, should be investigated. And I think these are the two things you could look at. And sometimes people get redness over the skin, but that's a more later stage. Or sometimes I think it's very important that people think of breast cancer as a disease of the old. Yes, it is seen more commonly in older patients, but that doesn't mean a younger person cannot get breast cancer. So sometimes, breast cancer also gets missed in a younger women, even though they present with a lump, or in breastfeeding women, because there's always a thought that it's just a lump or an abscess associated with the breastfeeding. So I think any breast change in any individual, regardless of gender, regardless of age, regardless of their stage in life, should be investigated.
Yeah. So as humans, it's a basic tendency to ignore something very small, which actually
Hmm.
leads to something very big. So yeah. So just a second. Yeah. So we are speaking a lot about its symptoms and the causes and all that. So I'd like to know how do you address someone who has a serious condition of this breast cancer, and also how does the after cycle or phase of the treatment looks like.
So, I would say that it looks different from everybody. And when we discuss the investigation report, or when we break bad news and tell them it is cancer, people respond in different ways. So, of course, sadly, we have patients who sort of break down in OPD. But as doctors, I think we are also trained to deal with that, or not deal with, or to help patients through
Yeah.
that, to accepting their news. And I think whenever we do a breast cancer diagnosis, we sort of do it in parts. And we do give them a general idea when we see them the first time around, because as clinicians, we do understand what cancer would look like. And we sort of lead them in the direction to tell you that, okay, I think this is suspicious, that we do need to investigate it more. And let's see what it's going to be. And then
Yeah.
when we see them with the report, we will probably give them the news that, okay, we have taken a biopsy and it does say that you have this sort of cancer or this grade of cancer. This means that you're going to need further treatment. And at this point, I think there's generally a pause and accepting the news. And very often it takes more than one OPD consult to really get to that point where the patient is willing to listen to what's next. And sometimes they're in a bit of a shock and they're like, okay, what's next, what's next? And I think it's important to take a pause then and just be like, okay, so this is the diagnosis, and what's next happens slowly, slowly, over at least two or three consults, where they're able to understand what's next. So, generally, treatment of breast cancer is surgery, chemotherapy, radiation, hormonal therapy, and there are a lot of other drugs that are coming into the scene, like targeted therapy, and even more recently immunotherapy. So based on what type of cancer you have and at what stage you've been diagnosed, we use a combination of these treatments. And whenever we have a new patient, we generally discuss each case with
Okay.
all the teams. So we have something known as a multidisciplinary team, and we have meetings with the chemotherapy guys there, with the radiotherapy guys there, with the pathologist, with the imaging people, and we discuss, okay, what is the best possible treatment for this patient. And then we discuss that treatment plan that we have made with the patient. What are they looking for? What do they want? How important is breast cosmesis for them? All of these things. There are some patients who completely refuse to have chemotherapy. There are patients who will say, I don't care if you can save my breast, I want you to remove it anyway. So what we plan and what the patient thinks their treatment goals are, they need to match at some place. So this requires a couple of consults, as I said. And breaking bad news is actually something we study as clinicians. We just don't randomly go and tell the
Yeah.
patient anything. There are phases to it. So yes, we talk to patients through a very vulnerable time and we guide them through it, but it's in phases. You can't dump everything at one stage on anybody. I don't think even I would be okay if that
Yeah.
happened to me.
Yeah, I think that's a roller coaster of emotions and process. Yeah, so as much as there are physical symptoms and effects, I think there are also mentally, this news affects people, and both are equally important. And yeah, speaking of which, as a normal person in my household, I've heard a lot of things about how there are one person is more prone to cancer if they use, deodorants. And as you said before, because of not having to breastfeed, that might affect or be a main cause of breast cancer. So, likewise, I'm sure that you would have addressed many myths in your career. Would you like to break any myths and make it? Yeah.
Sure, sure. So starting with your question, I would say use of deodorant is
Yes.
not linked to breast cancer at all.
Okay.
And that is a big myth.
Okay.
Using deodorants, wearing underwire bras, wearing black bras, none of these have any link with breast cancer.
Yeah.
Um, I think the other thing is, oh, mammography spreads breast cancer. So mammography, I know it, they squeeze your breast between two plates, but even if breast cancer is there, it doesn't get spread with the use of a mammogram, or the radiation from a mammogram does not increase your chances of getting breast cancer, because we're not doing a mammogram every day. At most we would advise once a year, once in 2 years. So, mammogram doesn't increase your risk of breast cancer. The other one is that a lot of people think it's a women's disease, which it is not. Men can get it too. It's not
Okay.
unheard of. It's rare, but it's not unheard of at all. And it is especially linked to familial breast cancer. So, men who have a lot of breast or ovarian cancers in their family, or prostate cancers in the family, they are at a higher risk of probably developing breast cancer. So while we do not recommend that men need to have a mammogram or come for a clinical breast examination, they should at least know what breast cancer looks like and not ignore thinking that they could never have it. So I think that's another myth, is that men don't get breast cancer. And probably that there is still a scare that the second I'm diagnosed with breast cancer, they're going to cut off my breast and throw it in the wind. So not everybody with breast cancer needs a mastectomy. We are able to save more and more breasts now because of advances in chemotherapy, radiotherapy, and even the techniques we use in surgery.
Yeah.
So we are able to conserve it safely, and that's the important part, is that we're not increasing your risk of death from breast cancer in any way. So there have been multiple studies, meta-analysis, 25 years follow-up, which tells us that breast conservation surgery, provided you take radiotherapy, is equivalent to mastectomy. And in fact, we had 2 years back, we had very exciting data coming from Europe, from two different countries, which told us that in early breast cancer, it might be better to have a breast conservation surgery than a mastectomy. We don't really know exactly how this works, but that's what the data tells us. So I think at least we can translate it to the fact that it is at least equivalent to a mastectomy. So just because you have cancer doesn't mean that you need to remove your whole breast. There are some cases, patients who have a lot of skin involvement,
Yeah.
or something known as inflammatory breast cancer, or in patients who have multiple tumors in one breast, in which we can't take out all those tumors and still have any breast left. In those patients, we may need a mastectomy. But our reconstructive guys are doing such a good job now. We're able to take abdomen tissue and create a new breast mound. So there are lots of options available. And it's very important, as I said, there is a doctor's treatment planning and there is a patient's treatment goal, and both of them need to come together, and something known as shared patient doctor decision making needs to happen. So that is our focus nowadays. But yeah, some of the myths we cleared, I hope, regarding male
Yeah, of
breast cancer,
course.
what kind of bras you can wear. I mean, wear anything you want, don't wear one if you don't want to. But it's not going to affect your breast cancer risk for sure.
I think that is something we all needed to know. Actually, I was not aware that even, male also has chances of getting breast cancer. So yeah. Yeah. So I like to ask that, uh, is there any interesting story or any success story or any personal story from which you've learned or you would like to share with us?
um Breast cancer or any cancer, any treatment disease, um there are different stories. Everyone has a different journey, and they're all sort of equally inspiring.
Yeah.
Especially women are known multitaskers. So whether you like it or not, as you will have women who are working but still taking a majority of the household load as well, and still being the nurturers in the family. And it will be very rare where you don't find that scenario. Even
Yeah.
if there is some help, it's always just help. It's not, it's never fully equal as far as I've seen it. So when women go through disease process like that, you will see them, I mean, it's generally so inspiring. They will be coming for their chemo, but they'll still be taking care of their household, they'll still be going to work, and it really comes in. So inspiring stories, I think, I don't know if a lot of you saw it. If last week we had someone, a news reporter, who came out and talked about her disease diagnosis and prognosis on her the news. And she talked about how she was diagnosed with a stage 3 cancer, although she had no high risk features.
Okay.
And how certain race and ethnicities have a worse prognosis, and that is a known fact. And those are some of the things that nobody talks about, and those are the things that people don't even know about. So that's some, I thought that was very inspiring, that people coming out on national television and talking about something so personal. And when uh, public figures talk about it, sometimes it's not looked at very positively, but I think it's very important because it
Yeah.
generates conversation, and conversation about something that was thought of as a stigma or something to be ashamed of, embarrassed, and that conversation needs to be generated. Another thing that comes to mind is our patient volunteers. So we have a lot of patients who have been treated for cancer, not once, twice, but 3 times, and they come back. Where I was working earlier in that hospital, we have someone who's had cancer 3 times um, in the breast, and she comes every day and talks to our patients who are about to have surgery, gives them information about the surgery, and she sees them after the surgery and teaches them physiotherapy, or talks about how to take care of your wound, how to take care of your drain. And when it comes from a doctor or a physiotherapist versus it comes from someone who's actually gone through it, it makes a huge difference. So does she feel 100% every day? No, she does not. I'm sure when she started her journey, she found this quite triggering, being in the same setup, being with people who are going through cancer. uh, but I think it's very important that there are patients who are able to donate that kind of time, are able to work towards this. It really makes a difference to our patients when they have patient volunteers who come and speak to them, who hold support groups, who work towards cancer awareness. So I think those are always inspiring stories,
Yeah.
is patient volunteers probably.
Yeah, of course, that was very wholesome and inspiring, how everybody comes together to help each other in need. Yeah. So I think that was the end of our session, ma'am. Thank you so much. It was very informative, and I am sure that all your, whatever valuable information you shared was really an asset to everybody. And I think, of course, it's necessary for everybody to start speaking about this more and more. And I wish you all the best for your future.
Thank you.
What?
Thank you so much. And thank you, IC Tales, for providing me this platform. I
Of
think
course,
this is just one of the ways where we can reach more and more people. So I think all efforts are really appreciated. Thank you.
of course.